StatSafe simplifies inventory management with options to move, remove, audit, and return inventory to the StatSafe cabinet. The audit and remove marked items are the most frequently utilized functions. There may be circumstances when multiple medications need to be removed from the StatSafe inventory. A typical example may be underutilized or expiring medications. To quickly remove inventory, use the Remove Marked Items function. Before you perform this action, the pharmacy needs to prepare a removal list on the portal. Once a removal list has been created, go to Manage Inventory. Then select Remove Marked Items. The pharmacy's removal list will display on the screen. Choose the first medication to remove. Select Remove to open the location. The med location is displayed on the touchscreen as well as a status light on the cabinet. All other drawers and bins remain locked. Retrieve the medication with the correct serial number and scan the barcode to verify you have the correct medication. StatSafe will not allow the process to proceed with the incorrect package. Once a medication is removed, select Finish and repeat the process for the next one to be removed. The inventory audit function has similar steps as Remove Marked Items. First, select Inventory Audit. Then select the drawer you want to audit. Retrieve the medication, count the meds, and enter the quantity. If the quantity entered is incorrect, you will be prompted to re-verify the count. Once the count is complete, return the medication to the StatSafe. Repeat the process until all medications have been counted and select Finish to complete the audit or continue auditing other drawers and bins. The result of the audit will be available on the portal immediately after completing. Move, remove, and return stock all function in a similar manner with easy-to-follow steps.